People die from this, don't they?
Yeah, some do, but not everybody. Lots of people live with Parkinson's for 30 or 40 years.
Yeah, but how?
Well, that's the point. I mean, we just don't know yet how it's going to affect each person individually. So your mom might have the lightest case of it in the world. She might not have it at all. So I think we should just try and stay optimistic.
I'm going to medical school. Well, I am.
Millie, it's the middle of the night.
Go back to bed.
Well, I'll rub the cramps out for you.
I work all day. I have a full day of clients. When am I supposed to clean this house?
Well, you're
not
supposed to clean the house. Rosa does that. You're supposed to get some rest.
I hate this vacuum.
The doctors say rest and conserve your energy, and then you start these night workshops at Anacostia.
That's because there's a need.
No, what you need is to conserve your energy, and what you need is to cut back.
Oh, if I do that, my clients will quit.
No, your clients aren't going to quit. They love you. They're not going anywhere, but you should start thinking about seeing fewer of them. Honey, you almost fainted yesterday. Your blood pressure's out of control. I mean, you're losing weight. You can't afford to lose. And then you start with these new projects that you don't have the strength to finish.
What are you trying to say?
I'm trying to say slow down, and I want you to go to NIH. They are the pros, and they'll figure it out. We're not going to find a cure for Parkinson's in the whole Earth catalog.
Oh, and we will at the National Institute of Health.
You know what I mean. Just agree with me for once. Just agree with me. Say I'm right. Then I'll do your other leg, and we can go to sleep.
What I'm more concerned with is the effect that all these medications are having. Principally, I'm seeing dehydration, which alone is enough to interfere with the Cinemet's ability to do its job.
So what do we do?
I think we should go back to zero. Take you off everything, gradually. Then start again with the Cinemet in precise, measured doses, until we can determine what's ideal. We'll have to check you in here, though. Figure on 2 weeks.
Not possible.
Millie, if that's what he says, that's what we should do.
No, I'm sorry, okay? I have clients. Too many people count on me.
You want clients 10 years from now?
Afternoon, Mrs. Kondracki. Blood pressure time. Oh my God. Room 707 now.
No, this can't happen. This can't happen ever again. She was like a living corpse.
Well, part of the strategy...
I want her back in the cinema. I want her back in the cinema yesterday, and don't you give me a reason why that can't be done.
All right. We can do that. We can do that. But Mort, there's something else. Millie's situation is more complicated than most. A tenth of the people we test for Parkinson come under a category we've been calling Parkinson Plus. We know very little about it, or how to treat it.
After about a week, Millie came home again, but she was never the same. After that, she had less control over her body, and her speech was getting worse. And sometimes she'd get so depressed that she'd talk about killing herself, and then in the next breath, she'd bring in a new client or add some other project to take on, and nothing I said, nothing anybody said could slow her down. All I'm saying is that Rosa hadn't called the ambulance. You'd be sitting there on the bottom of the porch right now.
You know what? You're totally overreacting.
You'd have to drive yourself to the hospital.
I slipped on the stairs.
And that's when we learned that one of the features of Parkinson's Plus is the loss of balance. And from that point on, Millie would trip over curbs, over carpets, over anything or nothing at all.
Take the car to the garage. On days when it's wet, you should take the car to the back of the garage. One bag at a time. I know. I'm sorry.
Mr. Kondracki?
Just one bag at a time. Yeah.
I need to ask you some questions.
I'll be back in a second. What kind of questions?
Your wife's injuries, Mr. Kondracki, they raise a red flag.
What are you trying to say?
Look, from our records, this isn't her first fall. Now, the staff here, they're trained to be on the lookout.
You think I hit her?
No, I'm not saying that.
What, you think I pushed her? That's why she keeps falling, because I push her?
Mr. Kondracki, domestic violence, even the possibility of it, is something that we have to look into.
Excuse me.
Mr. Kondracki? Yeah.
You're right. This is not her first fall. You can check with the staff. Ask virtually any one of them.
Hey! What's the matter with you, lady? You can't see?
I saw you, but my foot
Your
moved.
foot moved? What the hell is that?
It-
What's the matter with you, lady?
It slipped. I don't know what happened. Please, I'm sorry.
What, are you drunk? It's 10 o'clock in the morning. Are you drunk?
No, I have a disease. I have Parkinson's disease. I'm sorry. I'm sorry. I'm sorry.
I'll take cabs and get rides. I'll move the office back to the garage.
Well, everything else we can work on, the medicine especially. Because every time your situation changes, so the treatments.
Yeah, okay.
You're always elusive.
I've lived a good life. I've been good. What have I done?
You haven't done anything, Mill. It's just not the way it works.
I've always believed in God, so why is he punishing me? What have I done?
Nothing.
I'm not going to be able to do things on my own anymore. And our friends are going to disappear. And I'll be weighing you down while you'll be wiping dribble from my chin and dreaming of your Vassar.
No.
Why should your wife have gotten you places?
No, not where I am right now.
You're gonna put me in a nursing home and you're gonna forget about it.
No.
But I can't, darling.
No.
I'll die like that if you do. I'll die like that.
Never. Never.
I didn't know you were still driving.
No, she's not. She's not anymore. But she's still losing her balance. And then she's having trouble turning over in bed, and then she'll turn over too far. So we end up putting a rail along the side, but her lips have been pursing. They're kind of pulling in all tight.
Dystonia. It's not a medication, it's just part of the package.
It's uncomfortable and it's unpredictable, and I hate the tremors.
We've been hearing about cell transplants.
Yes, very exciting. But I think medically premature.
Well, are there any other options?
Well, there is a surgical procedure. It's called a pallidotomy. They're doing it at Emory, down in Atlanta. They use an electrode on a needle to probe certain areas of the brain. The patient is actually awake during the surgery, helping them out.
I think we should try this.
Millie, there are pros and cons with this treatment. On the pro side, there can be a dramatic improvement. But some patients aren't that lucky. The brain can hemorrhage. Some get permanent blindness.
I like the pro side.